At a time of deep division in today's society, we must come together for humanity's sake. On Can We Talk 360, we strive to stimulate an authentic conversation on issues that affect all of us in an environment of tolerance. I am Eugene Pettis, attorney and community servant. Tune into our discussion to foster a greater awareness of yourself and others. Let's discover how there is strength in our differences and an abundance of possibilities when we stand together as one humanity. Welcome to Can We Talk 360. I am so excited to have a conversation with Maimah Karmo, who is the CEO of Tigerlily Foundation that we're going to talk about. And more importantly, we're going to talk about her entire journey. I think you're going to be inspired by her life story, and we're going to go over a number of touch points that I'm passionate about in our society and experiences that I've had. Not only is she an author, she's authored several books, including Badass Girl Book of Prayers. She's published Divine Downloads Transforming Through Trauma, followed by Unicorn Boss, and the latter was in 2020. And in 2010, her first published was Fearless, Awakening to My Life's Purpose Through Breast Cancer. Let me start off, if we could, Maimah, is so often people are defeated by some of life's challenges, and you use your life challenge to just really inspire and transform your life. Tell us about that journey in your younger years when you found out that you had breast cancer, and that divine moment that you made a decision which way you were going to go henceforth.
Yeah, thank you for asking. I think that people, when you're faced with a challenge, you have two options. One's to back down and one's to buck up, right? And so there's a quote by Wayne Dyer that I love. He says, when you squeeze an orange, what comes out? And I first thought, well, orange juice. What it means is when you're squeezed, what comes out is who you are. And I really feel like I've been asking God for some time when I was much younger, like, what's my life purpose? Like, what am I supposed to be doing with my life? And, when you're younger, you don't know, you kind of still seeking. And so when I found the lump in my breast at 31 and I, was going through that whole, what do I do? Oh my God. Like, I knew that this was a pivotal moment for me to figure out, like, do I just keep going to my same job and doing that job and getting paid and going home and feeling unfulfilled? Or do I think, it began to occur to me that other women like me, my age, maybe had gone through what I went through. Because when I found the lump, I was told I couldn't have breast cancer. I was too young to come back when I was older, that women who were younger don't get breast cancer. When I asked for mammography, they told me, well, insurance won't cover it because you are too young. And I got it and it came back clean because I had denser breasts, which women who are younger have denser breasts. So the technology was not even advanced enough to detect tumor in my breast. And I kept pushing for more testing, and they're like, well, the mammogram's clean. What's your problem? The problem is that my breast has a lump that I want to know what it is. And finally, I pushed for an aspiration. It wasn't aspirating. And then I got a biopsy. It turns out it was stage 2B triple negative breast cancer. And triple negative breast cancer is the most aggressive kind of breast cancer that's often found in women who are younger and who are Black. So, and also to top that off, there was no treatment targeting triple negative breast cancer at the time. So there are so many things that were odds that I faced during that finding out and then getting diagnosed process. And being told I had cancer, then they said, we can't treat what you have because we don't have medicine that treats that cancer, or treatment that treats that cancer. For me, that was devastating. And so I was facing a chasm. What do I do here? Do I just fall in, or do I just jump over and make a change? But as I sat there going through my treatment, I thought, there's somebody else who may be my age, may find a lump and think, everything I read says I can't have cancer, I'm too young, she would ignore it. Or she may go to a doctor and they say that she was too young and she would, trust the doctor. Or might get a mammogram and it may come back clean because she had denser breasts, so they wouldn't detect it and she think it was right. Or she might push for a diagnosis and they keep saying to her, you're too young, and she would do, listen and go home. And so, and then even for the ones who did get diagnosed, who may not have had targeted treatment, like myself, or who may have maybe feeling lonely because when you're at that time, they didn't have young adult cancer support programs. So
Right.
when I went in chemotherapy, I was the youngest person in treatment.
And
They
how
would
old?
ask me when I was
How
31
old?
years, 32 at
31.
diagnosis, but they
Okay.
would ask me, "Are you here with your mom or parent?" I'm like, "No, it's me." So it really gave me a chance to see people what cancer looks like. 'Cause it's not this pink, pretty ribbons and balloons. It's really devastating. And seeing people in chemotherapy alone and feeling myself very alone, it propelled me to do something that would help other people have a better outcome, have a voice, change healthcare policy, and create a space where people come to us who felt that they could be seen and heard and listened to and be a part of transforming healthcare journeys and policy in general. And we'll be in our 20th year next year.
That's amazing. When I said there were a number of touch points, in 21, I mean, I was exercising 2021, and I felt something shoot down my right leg. No big deal. It was really instantaneous. A few weeks later, I felt it again. And I'm a medical malpractice plaintiff's lawyer. So for 40 years, I've done medical malpractice at Halleckster, Pettis, and Schwam. And I went and looked at the dermatome nerves chart, and the sciatic nerve ended exactly where I was feeling it in the sensation. And to make a long story short, I went to my orthopedist and said, I think I have a sciatic injury. And he did a lumbar scan, and he said, your lumbar is clean. And he said, do you mind if I do one more MRI? This was Martin Luther King's day in 2021. And the night before, he called me and said, come pick up your film. I have an appointment for you to go down to Mercy Hospital in Miami. Me not even thinking about it, I didn't lose any sleep that night until I got the study that morning. And I knew his assistant, but that day she was different. She gave me the MRI report and said, good luck, Mr. Pettis. And I knew it was something. So I'm reading it as I go out to the car, and all over it was, I had cancer. And not just a small tumor, largest 10 centimeters. Mine was almost 20. And it had gone wrapped around my spine, which is what was sending the sensation to the sciatic nerve, and gone into my spinal column and into my spinal fluid. And I have told this story a million times, sitting there in that room with Dr. Temple, when he said, you have a very large cancerous tumor, which is the last thing I thought I would hear in this life. I heard God say, you're going to be healed, but I want you to be evidence of my healing power on this earth. As clear as you and I are communicating. And I can't say I've ever heard his voice clearer prior to that, but I had no doubt that he had said it to me on that occasion. And I put aside all the statistics of survivability and all of that. I just believed that I was going to live. But that didn't mean that I was not going to go through it. You have to go through it. And until you go through it, you'll never appreciate how difficult it is. So when I read your story, I was immediately moved by it. That not only did you handle it, but you enlarged your platform through it. Tell us how we got to Tigerlily Foundation.
Well, much like your story, I didn't hear God's voice. I felt it inside of me. Like I felt God saying, so I kept saying, why is this happening? What do I do with this? And the answer was Tiger Lily. And I'm thinking, what's Tiger Lily? It really is about hope. The name symbolizes the flower. I love the Tiger Lily flower. And women going through breast cancer are much like that flower. In the fall and winter, the petals fall off. You lose your hair, maybe your eyebrows, your eyelashes, your ability to have children. You lose one or more breasts. But in the spring and summer, the flower blossoms again. So women can see the flower as a symbol of their ability to be beautiful and strong and transform throughout their cancer journey, not just as a stopping place. It could be a catalyst to growth and healing in so many ways, spiritual healing and mental and all the things. So when I was going through my metamorphosis, I remember being in the shower one day and just done. I was like, God, I felt like Job, like what's going on? I was having hives, I was diarrhea, nausea, all the things, my skin was peeling. It was just horrible. And I felt like, what did I do to deserve this? Why was happening? I don't want to die. And I was so mad at God. And I got in bed and I was like, if you exist, I want you to show me that you exist. Give me proof. I need something. I was kind of like Thomas, like, I don't believe you anymore. Show me proof. And
Doubting.
yeah, but it's funny because I was reading, I always thought of Thomas as being like he doubted God, but then I was reading Joel Osteen. I get the prayers every morning from Joel Osteen and Neil Donald Walsh, and I have a ton of things I get. And he talks about Thomas differently than I ever heard before. He said, sometimes God wants you to be with him in a relationship. He wants you to talk to him. And Thomas could have said, "Oh yeah, I believe," and then inside be not believe, right? But he asked God, he's like, "I don't believe. I want proof." And Jesus showed Thomas proof. So you have to ask sometimes out loud, like talk to God and say, like, "I don't know what's happening. Show me," and He'll say, and then God will answer you, show you, like manifest Himself. So I was like very angry, and I said, "Show me proof." And then in the morning, I felt different. I still felt sick. I still felt I had a headache. I still had the nausea. I still have all the things, but I felt like this energy in my body I had not felt before, and I felt this sense of like cool water. I felt just so energized and like, oh my God. And I had these ideas come to my mind, like, what could I do with these ideas? I'm like, but there were so many ideas coming. I was like, I had to go to the Office Depot and get some paper. And I went and got some paper and put it on the wall. My mom's like, what are you doing? I'm like, Mommy, I have this idea for this amazing thing I'm gonna create. She's like, what thing? I'm like, it's called Tigerlily. What's that? I don't know yet. God's telling me. And so I began to kind of map it out. But it really was, what could nirvana in cancer care look like? Not even cancer care. What could nirvana in human-centered healthcare look like? Because cancer is happening to you, you're not the cancer. And so how could people build a space where you come to a doctor and they tell you, to your point, you shouldn't have had to leave your doctor and get in the car to figure out what's going on. I got a call at my office. That should never happen. It should be more like, hey, I got your results. Can you come in? And then they sit down next to you like they did it when back in the old days, they come to your house and they
Right.
sit down knee to knee and say, you know what? Here's what's going on, but we got you. I get it's a shock, like, but I'm here to hold your hands through the process. And so Technicolor really became this place of a patient safe space, a safer space to come to be able to breathe and exhale and get the answers you need at the right time in a way you can understand and get community and hope and love and sisterhood, and then be able to then catalyze what you've learned throughout the journey of us helping you to make a change in healthcare policy, a change in the healthcare system, a change in terms of clinical trials, a change in terms of health literacy, and people seeing Black women and men's and women who are Latina and other colors, seeing all our voices represented in ways that they were not before, and really working to eradicate barriers to care. Um, I would say that my hope, I really believe at the time I was like thinking, I'm just one person. What can I do? And God said everything. And so I tell people whenever I do a talk now, I say at the end, often I say, if I am possible, so are you. Because I began this journey as a 31-year-old woman, and it's been 20 years now, and I'm healthy and happy and whole. And I want others to have the same blessings that I've had. But I think that when you're giving of your life to others and you're giving in community and service, no matter how long your lifespan is, it's beautiful because you're living a life that matters and that means something that is paying it forward to other people.
One of the things that I often say is, no matter how long I live, at the end, I want to have fulfilled God's purpose for my life. I want the world to be better because I lived, and that motivates me. And I've been practicing 40 years, litigator. That's a long time, stressful. But I've enjoyed it because I've never limited my life to practicing law. I've always been community oriented. I've always been that person to try to answer the call of something wrong that I see in the community, which is how I started this podcast. I started it right after George Floyd's death. I called up the chief judge of Broward County. I just said, I can't sit still. I was the chairman of a private tower club up at the top of our building here. I brought it to that audience, and I just brought truth to power, called in the the county manager, the city managers, power brokers to say, we have to do better as a community. And that was in May. And I started off on that social platform And then in January, I got my diagnosis. And God indicated, I want you to go public with your diagnosis. A lot of people, I know men, that have diagnoses that they want to keep a secret. But I thought there was strength in telling people. And I started on this platform about Gene's healing journey. And as long as I could, I would do little snippets of where I was in the journey and what I was feeling, and some small things such as be a friend before you need a friend. Because so many things that I unintentionally deposited, I didn't deposit them to get benefit, but I deposited them to be kind to people, to lift others. When I was in need, I started getting it all back. And that's what made me think of be a friend before you need a friend.
I love that.
And all of those type of, the platform was no longer doing that journey, my social action platform, but it was about what God had put me in, and that was to get through this cancer and to use it for the greater good. You were 30.
I want to touch on what you just said though, because it's really powerful. People don't realize sometimes the beautiful transference that happens when you give to others. I did an interview yesterday, and someone asked me, how did you begin a nonprofit while you were in chemo, in the thick of it? And I was like, well, how could I not? But the beautiful thing is that giving to others saved me in a sense, in a way. Like because I was helping people going through cancer, I got community. I built community around me, but I was helping them. So inadvertently, I was helping people, but I was getting something that I needed as well. I was getting connections, and then over time, this thing, I mean, in 20 years happened in the blink of an eye, but it was giving to one person at a time and showing up even when it was not convenient for me, and when I had no money and a young child, and a single mom. And so like giving of yourself is such a powerful act of service, and you don't realize how much when your hand is open and you're pouring out, God is often filling your hands back up even when you don't see it. And so for those who are listening to your podcast, um, I love the Bible, the story where people are being fed by Christ, and has a one loaf of bread and the water, and he just breaking the bread, and it keeps spreading. So the one thing you have, one thing, one act, one word, one kindness can just ripple and spread, one act at a time.
And I was the president of the Florida Bar, the entire state of Florida, when it was 100,000 lawyers, and I was the first African American to hold that spot back in 2013. And just about 3 months before I started my tenure, I met Dennis Archer. Dennis he's a superstar. He was a justice of the Michigan Supreme Court, mayor of Detroit. He was the first African American to be the ABA president, on and on and on American Bar Association president. And I met him in person for the first time. We were in Dallas, Texas. And after I said, it was a pleasure meeting you. And he said, hold up a second. He said, as you continue to climb, he said, which hand are you? I said, I'm right hand dominant. He said, as you continue to climb, I want you to lift yourself by your left hand. And I want you to reach back and pull others by your dominant right hand. I've given hundreds of speeches. That phrase that Dennis gave me is the most memorable phrase that I've ever given. What it does, it changes our natural instincts. Our instincts is to use our best for ourselves. And if we have anything left, we may give. That phrase tells you, use your best for others, and you'll forever be blessed. I've spoken around the country. I've spoken all across this state. I've had people to drive places to say, I heard you speak, and they try to reiterate what I said, and they don't get it exactly right, but I know what they're talking about. And that was just such a powerful statement of giving of yourself for others. And I'm just a believer in my core that when you do that, you'll live a life of just pure richness and happiness. That's where I get my energy from, helping others. And
Same here.
Yeah, you're talking about the younger ladies, females, young ladies. As I read your platform, 15 to 50. When you think of breast cancer, you don't think of young ladies that young. I had a client who was 24, and she went through the same thing. They didn't believe it could be, and a young lady of African American, and finally she got the diagnosis at 24 years of age. I mean, and she started it's been a number of years ago, probably about 15 or so years ago, and I was trying to find her name because she started some type of program to empower people through her journey, which I thought was great at that point in time. If I come across it, I would certainly like to introduce you all so she could see what you were doing at Tigerlily. Why did you go back as young as 15?
Because that around that time between 13 and 15 is when you start developing breasts, right? And so it's really one of the things that I think saved me is having a mom who was a nurse who taught me the importance of breast exams at 13. So if you know your body when you begin developing your breast, then you know how to touch it and what to look for and how it should feel. It becomes a habit. You don't need to have a tag on your shower or a reminder on your phone or some kind of something on the fridge. It becomes part of your lifestyle, like your hygiene. It becomes health hygiene. And so I think I know that for a fact that knowing that early, if I hadn't been taught my breast exams at 13, I would never have made it a habit. And I wouldn't have known in my gut. Like I knew beyond any kind of, guidelines and doctors saying, no, I knew that something was wrong with me. So just knowing that it's important. And also we learned that women getting breast cancer are getting younger and younger. There's reports put out, I mean, we know this. I've known this for over 20 something years, but there's reports that, 20 years or so. But there's a papers put out this year. Women are getting breast cancer at younger ages and more aggressive cancers. And I've seen patients that have been as young as 18 years old, 16 years old. So I don't know. I believe that part of it's environmental. I believe that part of it is the diet. I believe part of it is the chemicals in our life, environmental to what I said earlier. But part of it too is that we're living in a world that's industrialized, and there's so many things that are, an animal or whatever, even vegetables are harvested and it gets to your table, and it's been, between the farm and the table and the giant, it's been like 3 weeks and it's still fresh that is not normal. I'm from West Africa. We would go to the market. And it's huge. When I first came to this country, I was like, is that a plantain, mommy? She's like, it's a banana. I said, why is it so large? They had been injected with stuff. It was bright yellow. I'm like, it's not how a plantain looks. And even the tomatoes, I'm like, that is not a plantain. Bananas are like this small. So like everything here is just so big and so all the things, and those things are unhealthy. Also, I mean, I'm making this light, but the more I studied cancer, and then one of the things I was adamant about was like, I want to know all the things that impact my health and why I may have gotten. But even the rugs we lay on, there's a reason why those rugs and pillowcases are water retardant, is there's chemicals in those fabrics that cause it to be water retardant, that are cancerous, right? Certain plastics. And so, there's been studies showing that babies are being born with the mother's birth cord having hundreds of chemicals in her birth cord because the mother's living a lifestyle that she doesn't know that's not healthiest, right? So there's children being born with a predisposition to getting cancer. Then you have all the things around them, and you have what they're eating in school. However, also there's a lot of, we're seeing that women who are Black and brown, we know for a fact that our epidemiology, our genetics are different. So that cancer risk is higher in that population. So when you add that, genetic disposition, and you add in all the chemicals and then the stress, I know that for a fact, like racism in this world and in health, it just, like I've never felt more stressed as I felt this year. And, those comorbidities can trigger different things. And, you have a child living in the home of parents that are stressed. So they're feeling that stress. They're eating certain things. They're doing their homework on the rug. It's just all these things are happening. And so I've seen more women get breast cancer who are under the age of 30 in the past 5 years than I have before. And although my journey wasn't one that I never would wish what I went through on anybody, including myself, when I got diagnosed, I immediately began talking about it. To your point, I used my voice. I went to church. A church first is when I first spoke, and then the media. And then I got on Good Morning America and Oprah and all the things. But then I worked to change healthcare policy, because policy is what makes a difference. So I met with a member of Congress who helped to change that policy, and she pushed for change for the age. We began working to change healthcare policy for women who are younger in 2000, probably 2009, 10. The age didn't drop for screening until last year. Um, but so it's really important. That's why it's 15, because that's when you're at risk as well. And knowing your risk factors and being able to change the factors that could impact your cancer risk can happen over time to lower the risk perhaps, or even help you find cancers earlier.
In hearing you, I was at Publix last week and I was getting a Honey Crisp apple, and there was another lady right next to me, and the apple was the biggest apple I've ever seen in my life. And I looked at the lady and I said, I said, wow, this is big. She said, I thought the same thing. I said, that can't be natural. I don't want that
No,
apple. It's the apple
we,
was it was so big until you just say, how did that apple get
you
that
want
big?
no parts of that apple, zero
Yeah.
parts. Okay.
And we both, she laughed and I laughed and said, I don't want that apple. And I went and got another type of apple. In reading about you, there's a lot of empowerment messaging to young women, and a lot of advocates to be advocates for change. Do you see people that you have touched along that journey through Tigerlily return and be of some support to your foundation?
Yes, and I will say this I'm so thankful. Like, it's a blessing when you help people go through something. They're your biggest megaphone. I've had the blessing of going to 3 or 4 events this month alone during Breast Cancer Awareness Month. And there are women who were there who are angel advocates. We train them to become angels, and they just get so pumped about the work. They start going to events and speaking, and they're wearing the t-shirts and they have the buttons in the bag. And this year, with all the things that have happened with the administration and the funding cuts, and we had to trim down pare back our staff. And I was just worried about how we're going to survive all of this, right? With pare down staff, less money coming in later. And then, but things were still happening. And I was just trying to, like, as a leader, just think about how do I get us from, here to the next place with like funding coming in, and how do I make that happen? As I got through the year and I looked back, we had these women who were angels who we'd helped. They came to us for support. We helped them we get them the resources, got them community, got them into all the things, speaking on the hill, lifting them up, flying them in for events, helping their kids, meeting their husbands. Even if they didn't make it, we're still part of the family. But there's so many who have made it and who are part of our family, and they were doing the work. They were on the Hill, on Capitol Hill. They were at the state level. They were writing op-eds. They were in the community doing events. They were telling their stories. They were on social media. And I'm so filled. I literally wanted to cry when I realized that because I planted, um, you plant a seed of hope in somebody, a seed of empowerment, that it's not about me as a leader or Tiger Lily. I want you to take the seed, we plant it in you, and I want that seed to grow like a flower, like a tiger lily. And the seeds sprouted, and they were planting those seeds in their communities across the country. And so that's the whole point of the organization. It's not about just us growing, it's us being able to plant those seeds of hope and empowerment and advocacy, and have them just fly off into the world and do what they do and to shine. And that's my proudest, I guess, to see people that come to you where they're like overwhelmed and they're scared. And I get them on a Zoom call and I'm just like, just breathe. I got you. Just breathe. I got you. And I breathe with them and I put my hand to their heart. Like, I make them hold their heart, and then we connect with them. We have a navigator now that does that with them as well. And then they get to get the support they need. And then they look back and go, I was there and now I'm here. I'm a baddie. I can do this. How can I help? How can I help? And then they start doing the things. And I just feel like that's the beauty of life. There's a video that I did, I'll show you, but it ends with me talking about if you light one person's candle and they light the next person's candle and then the next person's candle, you create a beautiful ripple of hope and love that spreads beyond yourself. And that's what life's about, lighting people's candles and seeing them waking up to have that hope, and inspired and being empowered to live their best lives. So you can tell I'm very excited about that, because that's like my
That's your
helping
zen
people.
spot.
That's my yes, my Zen place.
Yeah. The clearly you've gone way beyond just dealing with the moment of a cancer challenge. You've gone to the whole person, And everything I read on your site, everything I read about you, you're dealing with the holistic approach to life, which is instilling in them tools, if you will, lessons that not only gets them through the journey, but makes them even transformed in life in general. I bet, so many people look at life differently, think all things are possible if you believe, that type of hope, which is critical. I noted that you were appointed by Congresswoman on the
Debbie
federal
Wasserman Schultz.
Wasserman Schultz on the federal advisory committee on breast cancer in young women, which was established by the Affordable Care Act. And when I saw that, it's been under so much attack, nonstop. And with the impact of what's happening in our federal government, in the next week, the rates for these people on the Affordable Care Act are, at minimum, they said, are going to go up 75%. And many are going to go up to 115 and beyond percent, which is what the battle of what's going on right now in Congress in the closure. What are you all doing? What are you doing to try to get energy that can keep your program going, despite what may go on with the politics of Washington, D.C.?
Program meaning Tigerlily or the CDC work?
Tigerlily.
It's been interesting seeing all that's been happening. And like I said earlier, I'm very transparent. It was really scary watching all the defunding and things like, the list of words you can't use, like Black, woman, and female, and BIPOC, and vulnerable, and discriminate. And that's who we are. It's what I do. Help women who are facing barriers to care and who are facing disparities. I mean, it's, Black, white, brown, or otherwise, right? So people need health care. People need education. People need resources. They need hope. They need that right now. So I feel like we went through a period of months, people were kind of afraid to support us and fund, and funding was delayed or cut back or cut in altogether. But to my earlier point, the angel advocates, people we have helped, are aware of the importance of using their voices to create that momentum, right? And our community engagement work is actually quadrupled in the past year because a lot of the hospitals that are losing funding, the money they were putting towards community engagement is probably being used to cover staff, or the time they had to do that work is now short because they have to think about getting other funding to keep their hospitals and keep people insured and covered, or getting those wraparound services. So we are doing more work than ever in the community, and God is opening doors. I will tell you, like, the going through breast cancer and getting a diagnosis and having to build my organization with small funding here and there over 14 years before I got funding. Like, you mentioned the murder of George Floyd earlier. People didn't really think that a Black patient like me could lead a foundation and get funding like they would give to big nonprofits. So I used to fund it with smaller things, smaller events. And not till the murder of George Floyd happened that people were like, oh my God, you're doing great things, and the money came pouring in. And now we see the administration we're in now, and money's kind of pouring back out. But when you give somebody hope and you tell them that they have a voice, you've done something really wonderful and powerful and dangerously good. Mm-hmm. And so our patients are the ones speaking up. And people that are in groups that are funding us, that have wanted to fund us or have funded us, they want to do good. Their hands are just kind of tied in some ways, right? But they found a way to support us. And I will say that we're probably in a healthier place now than we've ever been because we kept doing the work. We kept going to people where they were in the communities and saying, what do you need? Having events, going to people's like churches and hospitals. And so whereas we have been impacted by this by the whole year, the work is still going on, and people are finding ways to fund us in ways that are creative, so it can't be sustained. But I'm always saying that we do need more money to keep the work going, because we have had our funding cut by probably over half. We had to cut back on staff as well. So Just before this recording, I was in New York at a policy summit talking about value-based care, and then I was at an event at Pfizer before that, and one at another company. And I'm literally always traveling, talking about what we do and trying to get support for our nonprofit work. So anybody who's watching, we welcome donations and support, grant funding. If anyone's like a high net worth individual, or even whatever you have, even if you're not high net worth, whether it's $10 or 100 or 1,000 or 10,000 or a million, we welcome your support, because people are getting cancer every day and people are dying from cancer every day. That should the things that we're seeing now become a long-term reality, we're going to see research dollars being cut even more, and people will lose access to life-saving medicines that won't even exist at some point in time. So I have a friend of mine coming over this weekend to see me. She's metastatic, she's stage 4, and her life depends on her getting the next medication when her current treatment fails her, to be able to have her life be, have another 6 months or a year. And so what we're doing is working with our partners as well in pharma to help them think of ways to get people in clinical trials to be able to see how our bodies work with these drugs. So people like this woman has medications that can help keep her around longer. So short question, long answer. Donations that have been helping us by people who we know, friends or family members, or people who want to support us writing a check to support a program. It's been really helpful. But I'm amazed by our partners who are also being watched, because they figure ways to fund us that keep us going, because I was afraid of the thing. I couldn't say that I was afraid of shutting down, but it was really like, like if I can't say I'm a Black woman helping people who are just facing disparities, who are vulnerable and having barriers to care, those things are things that I couldn't say in grants, right? And so I'm thinking, how do I support my patient population? But I do think, to your point earlier, like when God gives you a ministry, something to do, like you have to just be in that fire. And when I use parables and I talk about Bible verses. I remember like feeling like I'm in that fire, and like God's like, I'm in the fire, and I should be burning, right? But God's like, I got you. I'm gonna put a hedge around you. And so this year the fire was burned. It was hot. It was hot. It was crazy. And people were telling me, why don't you've done the thing, it's almost 20 years, just stop. People love you. They'll give guest speaking engagements, you write more books and discuss what you've done. And I said, no, God asked me to be with people in the valley, in the community. They need my face to be present with them at this time. If I back out of this, I'm saying that they want. So I just kept going, and he has taken me out of the fire in more ways than one. And I'm just still walking through it, but we're going to get there with people like your help and your listeners and viewers as well.
That's awesome. One of the you've touched on it here, and it's on your platform. Back 2 to 3 years ago, I did an initiative on healthcare disparities. I saw it live. I do medical malpractice. I can't tell you the number of cases I've seen that were malpractice, in my opinion, purely because of race. That they did not appreciate, they didn't listen to the voice of Black women, did not believe them when they said they were in pain, and people died. And I make money as a plaintiff lawyer, but I have a conscience. And I said, I have to see what I can do. And I thought about it, I prayed, and I came up with this healthcare disparity initiative. And I spoke at probably 25 churches going around Miami and Broward counties, some in person, some via Zoom, to bring to light some of the essentials of trying to avoid being a victim of bad care. I really see it a lot in older population that trust the white doctor, and whatever he says, I'm gonna do, without having the strength to say, explain it to me. As we go through corporate medicine, things are speeding up more and more, and faster and faster. You're getting shorter time with your doctor. People are leaving with no idea. I just had a case with this week. The guy was undergoing using a cancer medication, and he died. And the daughter called and said, he never knew he had cancer. Well, how could you be taking the cancer medication and just total miscommunication? But that disparity is real. When you look at breast cancer, the percentage of Black women getting misdiagnosed is greater than white women and even greater than Hispanic women. When you look at, I've had sickle cell anemia cases that's typically in people of color. And I had a white expert, and he's out of Detroit, and he said, I'll tell you, many of my white colleagues think they're drug seeking. And the client said that's exactly what they said to her daughter, that she was drug seeking. Those types of disparities and discrimination manifest itself in our care. You go back to COVID, when the doctor, I think she was in Minneapolis at IU, she's a medical doctor. She goes to her hospital for the drug of that moment, and the doctor said she was drug seeking. The lady went live on Facebook, changed hospitals to get the medication, and died in 2 weeks. She had COVID, and they didn't want to give her the top medication, and she's the medical doctor at that facility. Those are real healthcare disparities. What within Tigerlily, what within your own efforts outside of Tigerlily are you doing to try to break down those institutional disparities we have in our healthcare system?
Well, how much time do we have? We're doing so much. So we look at the whole systemic view of it, right? So first of all, educating a patient to understand her rights and what she can do to speak up for herself is important. So our Angel program is a huge way of getting people to understand the power they have to speak up for themselves, right? So we do the Angel program, and we get women into it to get educated, to get empowered, become the best advocates, and they can speak up for their health. That's the first thing. We also have toolkits we created called barrier toolkits, where the toolkits are about everything from what to ask your doctor about, biomarker testing, your medicine, clinical trials, your mind chart, how to understand all the things around your cancer journey, around fertility. So there's 15 toolkits that they can download before their appointments to help them understand all the things. So you go into your appointment with education, you go into your appointment armed with what to ask for. You don't feel so overwhelmed with what you don't know. We educate physicians as well on how to be better with their patients, how to take that time, how to take that deep breath, and don't forget why they began this work in the first place. Like, you're here to serve me. You took an oath to protect me. We do a lot of work with having patient-provider coaching and training and talking together to kind of discuss, well, you may have done this to me, and I think it's a problem. But the doctor says, well, I wasn't really doing that on purpose. And really, we do a lot of provider-patient conversations and articles and training and so forth. We do a lot of work. I've been speaking at things for literally like 2 events. I've been traveling like nonstop all month, more so than usual, but talking about to doctors and to pharmacists and to people who are nurse navigators about, how you care for me, how you see me as a human being. And so I really think that the more you talk about these issues and the more you present on stages, whether you're in policy settings or with doctors or you're with nurses or with people who are lay people, you have to create change on different levels of the spectrum, different spaces. So Tigerlily really hits on all those things. Our Beacon Symposium coming up in a few weeks. Actually, we have an event called Beacon. It's a policy event that we have in DC, and to bring together, members of Congress's staff, patients, other stakeholders to kind of discuss problems and solutions to those problems. We have an alliance we created called a Race Alliance, Rallying Access Towards Care and Equity. That's a nationwide community program. We do a lot of work. We have a tour that we're on constantly. We're launching a brunch series where people are coming to brunch. But by the way, we're going to discuss breast and healthcare and advocacy and all the things. So we really tackled things in a way that we do it where it's like we have these policy events, we're on the Hill, we're speaking to stakeholders, but we're also doing things where people are coming to have a good time, and we're helping them to learn how to use their voice. Because to your point, it's not that people just don't want to advocate, they just don't know, or they may be afraid to speak up because they might not get the right treatment or they might get blown off. And saying to a person, you can fire your doctor, people are like, I can do that. You can fire your doctor. They work for you. So we have a culture of health and badassery. Just you have to be able to
Badass.
know
I love it.
to demand what you want. And if you can't get what you want, you can hire and fire accordingly. And so that conversation happens on all platforms. And we have a TV series we do on Facebook Live. We do have a magazine that's in over 10,000 locations. So we really kind of build programs that impact people wherever they're going to be. We're on TikTok, Instagram, but we tackle everything that we can, from the pharmacy, from the home and the family, to the community, to the pharmacy, we have events at supermarkets. We were on the Hill, we're at church, we're at the hair salon. So wherever people are going to be, you're going to find Tigerlily.
That's awesome. Well, I'm going to respect your time. I could keep you much longer and have conversation.
We can do a part two. How about that?
We'll do a part two, but you're doing God's work, and I could not be prouder of you, having gone through that fire and come out a transformed person with the desire to not just walk away with your blessing, but to be a blessing in other people's lives. And may you forever be strengthened for this journey. It's not easy, but I hope you feel the satisfaction of listening to God's voice and that inner feeling that you talked about, and never let that light dim or burn out. That's your purpose. That's why you went through what you went through. And that's always my prayer, to use me for the purpose that I was put on this earth. And I think you have found your purpose, and the community is better for it. So I think it was my marketing director, Carrie, who is on but not seen, who found you and thought that you were spot on with what my values are, my experiences are, and the messages that I like to get out. So I thank her for that. You're a hidden jewel. I had not heard of Tigerlily, and had not heard of you, but you are evidence of, what do you say, badassery. Keep going, my sister, and hopefully our paths will cross again sometime.
For sure. We are kindred spirits, for sure. Yes.
And you can show your little dog who's been in your lap.
Oh my God. She's okay. Hold on. I have 3 of them. This is Sugar.
Okay.
Look at her big eyes. Say hi, Shuggy. This is Sugar.
All right.
And then there's Cinnamon.
Sugar, Cinnamon.
And there's Honey. Honey's eating her treat right now. So
okay.
Yeah.
So
they're my babies.
Those are your children, and you also have an older daughter as well.
Yes. We're having dinner soon, or tonight, because she's awesome. So she'll be 23 in December, and it's a blessing to see her grow up to be a whole woman.
Yeah, well, that's great. She's got a good role model.
Thank you so much.
So again, thank you for your time, and until we meet again, be blessed.
You too. Be blessed, my friend. Take care.
Bye-bye.
Bye-bye.
The law firm of Halitzer, Pedersen Schwam is a proud sponsor of the Can We Talk 360 podcast. Our firm handles medical malpractice, wrongful death, and catastrophic personal injury litigation. We pride ourselves in being advocates for justice on behalf of those who have been seriously injured. For decades, we've taken the lead in making your case our priority. It's who we are. It's who we'll always be. Halitzer, Pedersen Schwam. Serious injuries, proven results.
Thank you for listening to today's episode of Can We Talk 360. I sincerely hope that you were inspired to seize this moment in time and take real action towards change. Remember, all change begins with a conversation. Be sure to tune in every month for more fascinating discussions and motivational food for the soul. Please share with your friends, family, and colleagues. Follow me on Facebook, Instagram, and YouTube at Can We Talk 360, and visit us on the web at www.canwetalk360.com.